Hello, back again. Welcome to another episode of Real Health Talk with Dr. Coring. For those who do not know me, my name is Dr. Coring. I am an internist, board certified, as well as a hematology oncology fellow who's training to be a hematologist and or oncologist, and I'm passionate about patient education. Also passionate about increasing awareness around various health topics. That being said, I know it's a challenging time for our people that's living in the Panhandle. My parents live in the Panhandle, specifically Tallahassee, Florida. So Helene, essentially, they were mildly affected by that. But now it's another hurricane brewing in the Gulf at the time of this recording, and so therefore I think it's timely that we discuss how to prepare, specifically from a medical standpoint, um, even more specifically, our medications during these times. And so, emergency preparedness, specifically, how can we be better prepared as far as making sure that our medications, one, that we have our medications, two, that we have access to our medications, and three, that essentially that we maintain our medications during these times. So I think that's what I would like to talk about. And I would like to more specifically give you guys tips on getting prepared in advance during this time of potentially disaster. Natural disaster is what I'm referring to, in the setting of, our folks that are living in the Panhandle in preparation for the hurricane. All right, so what are the specific challenges that we may face on accessing our medications during times of natural disaster? And so one of the most prudent things is supply chain disruptions. For example, right now, I'm in North Carolina, and our health system has been affected essentially by Hurricane Helene, which destroyed one of the manufacturers that manufacture IV fluid solutions. And so, as you can imagine, we utilize IV fluid solutions for various reasons in the healthcare system. For something as standard as you come to the hospital dehydrated, we just give you IV fluids. To something more nuanced and more specific, we use for mixing chemotherapy to allow the patient to receive the chemotherapy using the IV fluids as one of the vehicles to administer the medication. So supply chain disruption can affect many facets in a patient maintaining their medication or even gaining access to their medication. Pharmacies can close, the manufacturers can be affected, and so that's a challenge. Power outages are also challenging. Essentially, some medications like insulin need to be refrigerated, so a power outage could make it very, very challenging for you to actually gain access to a viable medication, because if the insulin goes bad, then essentially the medication go bad. Access to your healthcare providers. And so typically during these times, your office, the provider office may close. And if that's the case, you may run out of refills and you may need your provider to authorize refills. But that can be challenging if the office is closed. So access to the healthcare providers is a challenge. Limited transportation. Maybe you need to go to the pharmacy because you ran out of the refills. So the provider have the refills for you, but you don't have access to gain the access to the medication because, there's a flood, there's blockages, there's trees down. And so limiting your transport can be a challenge as well. And lastly, stress levels, dealing with these conditions can exacerbate your stress levels, which can also maybe exacerbate your health condition. So if you have heart failure, making the heart failure worse, if you have problems with breathing, making that worse because you're hyperventilating because of what's going on. And so what I would like to do is not just mention the problems, But I think we should now talk about solutions. How can we better be prepared to anticipate these problems and put ourselves in the best position to have access to our medications and keep our medications viable throughout the duration of this catastrophic or potential catastrophic event. So the first thing we should do is we need to sit down, write down, and review our medications and our prescriptions. And so we need to make a list of all the medications that we have and that we would need. Making that list will also allow you to understand specifically how much of the medication you need and how it should be stored and any special instructions. And so therefore, once we make that list, we can determine the amount of medication that we need once we have everything written down. Once we determine how much of the medication we need, then the next step is to essentially go to the pharmacy and to essentially we need at least a 2-week supply on hand because we can't anticipate what's going to happen after the catastrophe. We don't know how long the pharmacy will be closed. We don't know how long the doctor's office will be closed after the hurricane or tornado or whatever natural disaster. And so we say and we recommend a solid 2-week supply of the medications that you need would kind of get you through until things start to open up after the aftermath or after, the hurricane and whatever the natural disaster should be. Also, we need to check the expiration dates on our medications. So before we go to the pharmacy and say, hey, I may need a 2-week supply of my lisinopril, for example, for your blood pressure. Let's make sure that lisinopril does not expire. Or the lisinopril we have on hand, maybe you think you have enough lisinopril already on hand. Just using this as an example. But let's say that lisinopril expires within a week. Well, you need to tell your pharmacy, not only do I need a 2-week supply of these medications that I don't have, I also need a 2-week supply of this lisinopril because it's going to expire within the next week. And so even though I have at least a month of these pills in my possession, these pills are not going to last me for 2 weeks because it's going to expire beforehand. So checking the expiration date is very, very important. Also, communicating with your health providers, scheduling an appointment in advance with your health providers as well before the hurricane comes. So if you know, okay, a hurricane is about to come, a tornado is about to come, it's projected, I need to schedule an appointment with my primary care doctor tomorrow to make sure that I'm up to date on everything and get all of these things done. That way, after the natural disaster happened, and you feel comfortable that you're up to date, everything is refilled, you're up to date on your checkups, any labs or anything like that. Because afterwards, you may not have access to your primary care doctor or any of your providers for that matter. And so making sure that you call these providers, scheduling an appointment before the natural disaster, essentially to make sure that you're up to date on everything. All right. And also during this visit, you should discuss any concerns for additional medications in advance. So say, hey, doc, do you anticipate me needing any medications in advance, because I don't know when the next time I'm going to see you after this storm. And so ordering or prescribing that now will give me an opportunity, to make sure that I'm up to date and up to speed on everything. And during that time, making sure you obtain any documentation for early refills. And so this is a great opportunity to tell your doctor, hey, doc, while you're at it, can you just send a message to the pharmacy saying that it's okay that I refill this medication well in advance, 2 weeks worth. I know I just received the medication, but I need 2 weeks worth in advance because I don't know when the next time I'm going to be able to have access to a pharmacy. And sometimes the physician could make that notation and send that over to the pharmacy. All right. What's also important is contacting the pharmacy that you normally go to in advance to understand their policies around natural disasters, because part of their policies may be to contact, or for you to contact your insurance company to authorize an emergency supply of medication in advance. And so there may be some bureaucracy and red tape involved, but understanding that bureaucracy and red tape ahead of time could put you at in a best position to be prepared, essentially. So calling the pharmacy, understanding the policies around emergency refills is very important. Also, if you receive your medications through mail order or online, you may want to call the pharmacy and ask, is there any convenient way that you could receive your medications outside of mail order? Because the mail system may be affected by this. And so it's very important that you access via phone call your mail order pharmacy or your online pharmacy and ask them about their emergency policies around accessing your medications. And you may be directed to call your insurance company as well. And so understanding the policies from the insurance company perspective regarding emergency provisions would be very important and prudent as well. And the next thing and the last thing I want to talk about is storing your medications, all right? So storing your medications properly during these times of natural disaster is very important. If you are prescribed medications that should be stored in a dry place, cool, dry place, it's important that you have a plan for that. Essentially, some natural disasters, specifically hurricanes, can cause environments not to be dry. And so you need to ensure that you have a container that's waterproof and that can safely keep your medications in a cool, dry place. And so it's important that you ask your pharmacist the proper way to store these medications, all right? Creating a portable medication kit is very important as well, because you need somewhere where if you have to evacuate, to quickly and easily access your medications. And so maybe a nice waterproof kit where all your medications are in one container and you could quickly grab and go. That's the idea. All right. And the last thing is, if you have any medications that need to be refrigerated, we need a plan for that. And so dry ice, styrofoam containers is the most optimal way. All right. So gaining access to dry ice and styrofoam containers and storing your refrigerated meds or medications that need to stay or be refrigerated is the most optimal way, especially if you were to lose power. And FYI, for your information, insulin, even though insulin we require it to be stored, there are some insulins that can be safe at room temperature for up to 28 days. So again, it's very important to access your pharmacist at a pharmacy and ask that pharmacist, after you look at your list of medications that I talked to you about writing down. So you take that list to your pharmacist, your necessary medications. Ask the pharmacist, what is the best way that these medications should be stored? Based on that answer, then you should take proper provisions to store those medications properly. All right. So we talked about a lot. All right. But the take home message here is, if you are pending natural disaster and you require medications to keep yourself healthy, then it's very necessary to gain and understand the provisions to, one, have access to these medications, and two, keep these medications viable so you can continue to take these medications, and three, understanding the natural or necessary provisions, again, to gain access to these medications for at least 2 weeks to get you through this difficult time. Okay, guys, be safe. Please take natural and necessary precautions. Listen to people when they say evacuate, but also gain access to your necessary medications to keep you well during this disastrous or potentially catastrophic time. That's my time. I love you guys. Like and subscribe, please. And yeah, be safe, guys. Peace.